Next up, we have Robert Davidson, the Executive Director for the Mental Health Association of Essex County, New Jersey.
Thank you very much. Good afternoon. It's good to be here. In 2001, it was a coincidence. I took a tour of the County Psychiatric Hospital. That wasn't a coincidence. I was on a monitoring committee, and I did that on a regular basis. But what was a coincidence is that same day, I took a tour of the county jail in Essex County, which is located in Newark. And I was startled and stunned when I realized that the population in the jail was more impaired, sicker if you would, more impaired by mental illness than the population in the psychiatric hospital. So that, to me, really illustrated the problem. And I would invite each of you to go back to your home counties and do the same. And many of you, if not all, will probably have the same experience. And that experience has certainly motivated me. And every year since then, I do the same thing. I visit the psychiatric hospital and the county jail on the same day. And I still find people more seriously ill in the jail than I do in the hospital. Despite the fact in the last 15 years, the county correctional facility has been very innovative, and they've added a range of services, additional psychiatrists, additional social workers. What they've really done is build a mini hospital within the jail. Despite their efforts, I still see people sicker in jail than I see in the hospital. So the Essex County Correctional Facility, it's about 2,200 people. Depending on the county executive's mood, it's either the 8th largest correctional facility in the country or the 13th. He quotes different things. I'm not sure which one is correct. But it's big, and it rocks and rolls, as they say. And we have a jail diversion and reentry program there. We have an office right in the jail. Out of those 2,200 individuals, about 1,000 of them are on neuroleptic psychotropic medication. And about 50% of them have a mental illness diagnosis. And in the opinion of the medical director, our case management staff, and the warden, about 350 of those individuals really should be in a hospital, and they require that level of care. Our jail diversion and reentry program has certainly made a difference in these people's lives. We began the work in 2004. As a result of that, we have dramatically decreased recidivism. We've had an impact, but we haven't cured mental illness. Oftentimes, we provide the referral and linkage and the intensive case management to nowhere or to a poorly funded mental health system. So in regards to the Excellence in Mental Health Act, I think it would have a major impact on the work that we do, because there's many people in Essex County, the county executive, the prosecutor's office. They got a grant from the Attorney General to do prosecutor's diversion, to the point where a Superior Court judge, Judge Leith, actually keeps a mental health calendar. And once a week in the morning, she just sees people that have offended that have a mental illness. And she encourages them to go to treatment rather than have them go to jail. And it's very effective. The state funds our jail diversion and reentry programs. That's been effective. Last year at the county jail, we saved about $1.6 million in reducing stays there. As you may be aware, if someone is diagnosed with a mental illness, and I'm sure you're very aware, they are 4 times more likely to serve out their full sentence than the general population. And that's because correction officers are not trained to work with our population. I'll give you a tragic example. In 2004, when we first started our jail diversion and reentry program, I noted that the individuals in the mental health unit were never let out of their cells. They were in there 7 days a week, 24 hours a day. And what I learned was it wasn't the correction officers being nasty or mean, though there were some improvements that needed to be there. They, in fact, did not know how to work with the population. They had never been trained. Most of them were good men and women that wanted to do the right thing, but they had never been trained. And we were able to provide that training. And as a result of that, people are more exposed to the general population and recreation and different things like that. So the best way to divert someone from a jail is to provide the services so they won't need the jail to begin with. I'll give you another tragic example. I talked about the 350 people in the Essex County Correctional Facility that, in the estimation of the medical director, require hospitalization. It's been our experience, and our research has showed this, that the sicker the individual is in the jail, the lighter the offense is that got him there. So in essence, they're being arrested for the crime of being mentally ill. Now, they've urinated in public. They've destroyed property, disorderly conduct. You know, they've done something that certainly requires the attention of society. But to take these individuals and incarcerate them in facilities like this gentleman runs is not in the interest of that individual, their families, the facility, and society as a whole. So I think I know that the Excellent Act can make major improvements in this area. Just by, I was talking to Jeff this morning, it's just as simple as adequately funding what we do. If we're adequately funded, that in and of itself will make a difference, because it's not magic. We know that treatment and case management and housing make a dramatic difference in people's lives. Now let me close with another word. While I certainly think that certified community behavioral health centers would make a big difference and it's the way to go, don't underestimate the fact that some individuals still require inpatient psychiatric hospitalization. They're that ill because of their mental illness, usually schizophrenia, not always, but largely. And what we found, many of the individuals that end up getting incarcerated at the Essex County Correctional Facility are there either because they couldn't gain admittance to a psychiatric hospital, this gentleman referenced that earlier, or they were discharged too soon. When I first started at the Mental Health Association of Essex County in 1999, the average length of stay in an acute care facility in Essex County was 23 and a half days. 23 and a half days. Last year, it was 5.6 days. We have not made the corresponding improvements in the mental health system to justify that. So those are the issues that I think should be addressed and that I believe would have a big impact on the system and the individuals that that system serves. Thank you.
Thank you, Bob.